Hello everyone, I am Dr. Gaurav Sindhwani, Associate Professor, Department of Anesthesia, ILBS Hospital, New Delhi. Today I am going to tell you about the high flow nasal cannula machine and how to use this machine for ventilating the patients who are breathing spontaneously. This is a air VO2 machine which we are using at our center, and to use this machine all the parts of this machine has to be assembled together. Now to assemble all these parts, this oxygen port is attached to the center supply, and after that this oxyflow meter is attached to the oxygen inlet of the machine, which will deliver the oxygen to the machine. And this is the water chamber. This has to be filled with the distilled water. So, I am filling this water chamber with the distilled water. As you can see this mark on this water chamber, the water has to be filled up to this mark. Now, once the water is filled, we will attach this water chamber to the machine. Now, to attach this, we have to press this button and fit this water chamber into this machine. Now, once the water chamber is fitted properly, this ventilatory circuit will be attached to the machine. It has two ends, this circuit has two ends. This end will be attached onto the top of the machine, and this end will be attached to the nasal cannula. Now, once the ventilatory circuit is attached, the nasal cannula will be fit into this ventilatory circuit. This nasal cannula comes in the different sizes, and appropriate size of nasal cannula should be selected based on the patient age and the weight. Now, we will attach this nasal cannula to the patient face. Now, once the cannula is fitted over the patient face, make sure that the nostril part of the cannula should not be kinked or obstructed, otherwise the machine will give an alarm of obstruction. Now, once all these settings are done, I am going to tell you how to do the machine settings. Now, to do the machine setting, first of all, this is the power cord of the machine, which is attached onto the back side of this machine, as you can see here. This is a power cord attachment. After the power cord is plugged in, the machine is switched on by pressing this button for few seconds. You can see that the machine is now switched on. This machine will take few seconds before it shows the setting of the machine. We have to select a adult mode or a junior mode. To select, we have to press this button for few seconds. Now, you can see that the butterflies are seen on the screen. That means the junior mode is active. Now, for going back to the adult mode, we have to press it again. Now, you can see that the butterflies have gone away. That means that the adult mode is active now. Now, to do the further settings in the adult mode, we have to select the settings. We have to select the parameters by pressing this button. So, I am pressing this button now. You can see that the temperature has come onto the screen. All values on this machine are initially locked. So, to unlock this value, we have to press both these buttons simultaneously. Now, you can see that this value is unlocked, and I can increase the temperature or decrease the temperature. Normally, the temperature for all the adult is set to a value of 34 or 35 degrees Celsius. So, I am setting it to 34 degrees Celsius, and I am locking it by pressing this button. Now, I am going to the next value, which is the flow rate. Now, again this value is initially locked. So, I have to unlock this value. So, for unlocking, I have to press both these buttons simultaneously. Now, you can see that this is unlocked, and the flow rate can be set anywhere from 10 to 60 liter per minute. Normally, for the adult, we set a flow rate of 40 to 60 liter per minute. So, I am setting it to 50 liter. and then I am locking this value by pressing this button. You can see that it is locked now. Now I am going to the next value, which is the FiO2. Now to increase the FiO2, the flow rate in the flow meter has to be increased. As you can see in the machine, as I am increasing the flow rate in the oximeter, the FiO2 is increasing. As you can see here, now the 50% is adjusted at a flow rate of around 20 liter of oxygen. This is how the high flow nasal cannula machine is assembled and used. Thank you.